Do you really have to have that IV, or have you just been told that? Because, if you get the IV and you're planning to have a natural birth, this can actually sabotage your attempts to have a natural birth. It can undermine your confidence, lead to unnecessary interventions, and definitely sabotage your physiological process. Hi, my name is Carly Bonderud, and this is the Empowered Birth Series, where I go deep into everything that you need to know to plan and get your empowered true natural birth. And if you've been following along with this series, then you know that we're going into the 20 natural birth traps. What are natural birth traps? Well, if you're new to me, then you probably aren't familiar. But if you've been following me for a while, then you know that natural birth traps are exactly what they sound like. They're traps that you fall into that basically you think that you're having a natural birth and you're going through all of the motions and doing all of the things that you're supposed to do in the medical system or what they say is safest. And then what happens is that things become more unnecessarily painful. You maybe have some complications that come up, and you're wondering what the heck went wrong? Why didn't my body work? Well, you fell into one of those natural birth traps. And natural birth trap number 16 on our list is the IV. So basically, what you're going to want to do before you even dive into this masterclass is understand that this is the do-it-yourself path. So with these deep dive masterclasses, if you're not already familiar, then what you need to know is that I'm actually going to go deep into this topic. I'm going to tell you the ins and outs of why you don't want the IV. And I'm also going to share some context of when you actually want the IV or why it's even a thing that they do in the hospitals in the first place, so that you can truly understand this. Because I believe that information should be free and you only pay for access to me and my empowered birth coaching queens. So this basically means that I'm putting out this information and I want you to treat this masterclass as if you had sat down and decided to pay me money to take this class directly from me. That means that you're going to want to make sure that you're in a quiet place, that you can take notes. And if you really don't have time to sit down for about an hour, sometimes it's less than that, then what I'm going to suggest is check the description of this video. We may already have the PDF transcript available, or sometimes our software kind of messes up and, AI isn't perfect. The internet's not always perfect. We can't always guarantee that it's up right away. But even if it's not, just send your questions in to hello@empoweringmomsbirth.com, because the deeper you go with empowering moms, the more treasures that you can uncover. And I have a library of resources at my disposal. I'm constantly checking in with the birth communities and getting updated on the latest research. And, being a doula and a birth advocate and somebody who did not even give birth with the IV at all, I have a lot of information about true natural birth. And I also have information on interventions, why the context is important when making decisions, and why you can't just go into the mom groups and ask, should I get the IV? Should I get the heparin lock? I'm going to be addressing that all inside of this deep dive masterclass. Okay, so as I said, you're going to want to take notes. If you are choosing the do-it-yourself path, because I have 3 paths to getting what I call the empowered birth method, then what you're going to also want to do is watch this video 3 times, or at least go over the transcript 3 times. Because the first time you're getting the overview, it's new information to you. The second time you go through it, you're going to get those aha moments that you maybe overlooked before. And the third time, you're able to implement and integrate that empowered birth method so that you can come to your birth from a place of power instead of a place of fear. This is one of the missing pieces of most birth education, because we have a dichotomy, and this is part of where the natural birth traps come in, where one side is saying never get the IV because it's not natural, and the other side is saying, well, the IV is important because such and such might possibly maybe happen. And so we've got the medical model and we've got the natural birth model, and they're usually fighting. I am the bridge, and The empowered birth method basically allows you to make the decision that's right for you. I'm not going to tell you whether to get the IV. What I am going to tell you is the context. So how these masterclasses basically work is first I'm going to share a story with you. Then I'm going to go into how this is a trap and undermines your confidence, how it leads to unnecessary interventions, and how it sabotages your natural birth. I'm also going to share inside this masterclass about context. How did we get from having home births and having midwives all the way to this hospital birth where everybody is just assuming that you get the IV and at least get the heparin lock, but we don't do that at home births. What's the difference? Why is it like that? And understanding what's really going on. Because once you are able to see all the sides, because fish can't see the water they're swimming in, then you're able to make an empowered decision. I will also share a little bit about the context of when the IV might be appropriate and to make a backup plan, because we are all about aiming for a true natural birth and pulling back only as much as needed. So then I'm going to share into how to apply the empowered birth method in making decisions around the IV. And I'm also going to share about how to go deeper and the 3 paths to empowered birth. And then finally, we wrap up with a recap. I tell you what's next in the series, and then we're pretty much done. So now that you understand the overview of how this works, I also want to let you know at this point that I am committed to you having an empowered birth, whether you work with me directly or not. And because of the fact that most education is not accessible to a lot of people, moms usually they go one way or they go the other way. They are coming to their birth and they're already afraid. And you go into those mom groups and you get a very skewed lens. So I'm going to pull the curtain back and I'm going to let you really see what is your truth? And all I ask in return is that you pay it forward. Like, share, subscribe to this channel, comment. If you have any questions, please reach out to the team, hello@empoweringmomsbirth.com. Because even when you comment, and we do read them all, I myself love to read the comments on the videos. I will respond to them. If you have an urgent question that is time sensitive, I may not see that question in the comments, and I really want to make sure that you get the help that you need. So make sure that you are utilizing the email. If you are on the newsletter, then your path is just to hit reply to any newsletter. And if you are not on the newsletter, you're not subscribed, then your path is to just email the team, hello@empoweringmomsbirth.com. Now, I'm also going to tell you that priority for answering questions usually goes first to our high-level premium coaching clients. They get us on WhatsApp. They sometimes even get to work with me directly if they're at the highest level. Then after that, we have our self-study VIP students. They are getting a lot more help. Then we have our self-study, which is just put your name and email in and you get a course. Technically, if you're also subscribed to the newsletter, you're getting the same level of help because you have access to any self-study course that is already available to any of the self-studies that are not VIP only. And as a subscriber, you also get my Empowered Mom Magic every single week. So you get extra tools and extra ideas of how to implement the empowered birth method beyond just what I teach inside these masterclasses. So as I said, the deeper you go with empowering moms, the more treasures you uncover, and you can pick any one of these paths. And I will go deeper into that later. But first, we're going to go into an empowered birth story, okay? So this is the story of 2 moms again, and both of us did not want the IV. For me personally, I was not high risk. I didn't see any reason to have the IV, and I just really hate needles. So I never had a single IV or needle except for the shot of Pitocin in my leg at the very end when I was delivering the placenta in the hospital. And what I noticed is this is not common. A lot of moms, when they are writing their birth plans, even for a natural birth, they are putting in that they would rather have the heparin lock or the saline lock and maybe not the full IV. And this is a compromise. This is something that's not actually necessary. And I even advise my clients, it's like, do you actually want this for your own safety and comfort? Or is this just something that you think that you have to have, and this is your compromise? And 9 times out of 10, it's for their own compromise. But inside the mom groups, when these moms are declining the IV or the saline lock and they're saying no in their plan, what I often see is that labor and delivery nurses will be like, oh, well, you know, you need to have an open vein just in case you hemorrhage, or just in case we need to get fluids into you. You never know what's going to happen at birth. And they're very, very pro IV. And then there's the natural birth moms that are like, you never want to have the IV. It's completely arbitrary. And like, don't let them have an open vein. And this is more where I kind of stand in this whole idea, because if you are not planning on having any medication during your birth, having an open vein is problematic. And I've talked about this in other videos when I spoke about Pitocin, is that you don't want to have an open vein. So the thing though is that you might want it just in case, or have that in your backup plan. Jenny was quite aware that she might be GBS positive, and at the time of birth, if she needed to have the antibiotics, it was more of a watchful waiting thing. And she also chose not to have any IV placement until she actually needed it. She ended up not needing it at all. She gave birth in the hospital 1 hour after she arrived. And, you know, even a high-risk mom can say no to the IV. So in these two cases, what I've really seen is that when we say that we never had the IV, we often see the moms freaking out. Well, what if something goes wrong? I mean, what if you need Pitocin right away? What if you need to have the IV placed because you need a C-section? And this is part of the point, because how this becomes a trap is it's undermining your confidence. If you're automatically having the IV, first of all, it hurts. Second of all, you're now having this mentality that even if it's not attached to anything, something could go wrong. If you are inviting in that energy of something could go wrong, I could hemorrhage, I could have the baby slow down and then contractions are stalled and I have to have Pitocin, or I need to have the IV placed because I'm about to go for a C-section. I need to have Pitocin because I'm about to hemorrhage. Like all of these things, understanding this doesn't happen at home birth. There's no IV being placed at a home birth. And if you are freaking out and thinking that just because you're having a hospital birth that you automatically need to have the IV, you are again inviting that in. You're inviting the idea that things are going to go wrong. Why is it that we have home births and we don't even think about the IV, but in a hospital setting, suddenly we think we need it? Well, that is because of the fact that there's context around that. So, as I said, how it undermines your confidence, first of all, is it automatically has you thinking that this is an emergency situation that you have a backup plan for, and you're more likely to invite that emergency in. The second thing is that it leads to unnecessary intervention. First of all, even if they're just placing the IV as a saline lock and they're not putting anything in there, you still have an open vein, which means that if the medical system is deciding that actually they don't really like your contraction pattern, even if it's just normal, or they want to slip you something, it is much easier to do that if you've already got that vein open, which you do not want. The other thing is if you do attach the fluids, then what this can do is if you are attached to the fluids for several hours in labor, this is why I also say go to the hospital at the last possible minute so this doesn't happen. But what happens is you have fluid retention. And this is being linked to breastfeeding issues later, because the baby also gets that fluid, which then means that their birth weight is affected. So then their birth weight is a lot higher. than it would otherwise be if they didn't have those fluids. So guess what happens once baby loses all of that water weight? Suddenly they are underweight. Suddenly your care provider is pushing formula supplementation because baby is not gaining the proper amount. When in reality, what is happening is that baby was just having an overinflated weight. The other thing is that because you are retaining fluids, now you've got all of this swelling that can happen, which isn't fun. So, you just might want to say no to the IV because if you are planning to have a physiological birth, it's really not necessary and it's more likely to lead to the unnecessary interventions. And doctors and nurses have been known to just slip Pitocin into somebody's IV just to speed things up and not tell the mom. And, it's just one of those things that happens with these category 5 care providers. Go check out some of my other videos about that. Finally, with your physiological process, if you need to feel safe and you need to feel confident and in control and able to surrender to your body, having the saline lock or the IV into your hand or your arm is going to hinder your ability to stay in the zone. Because if you have it in your arm, which some people suggest, then you are holding your arm like this, and guess what's digging into you? Or if you have it in your hand, it's still uncomfortable. You're not getting the full range of movements. It's not like this thing is invisible and you don't feel it. You can still kind of feel it. If you touch it, it's still going to affect you. And, if you're trying to labor and have these like surges and everything, and the nurse is trying to jam a needle into your hand so that this IV can be placed, it's no. And if you also happen to have a needle phobia, and this is another reason why I knew I couldn't be in the hospital for my first birth, even though I ended up there anyway, I recognized that I would be too tense to relax because just seeing a needle can send me into a panic attack. Just having the thought of a needle near me or needing to have one has me get like prickles on the back of my neck and I start sweating profusely. Like I get really nauseous. I have a vasovagal reaction, this is called, where I basically get to the point where I could throw up. And if you are feeling like that around needles and hospitals and medical procedures, then it's probably not the right environment for you to be there. You need to be able to feel safe in order to labor effectively. So that's another way that it can sabotage your physiological process. Okay, so now we're going to go into the context though, because why are we doing the IV? What is the actual reason? Well, if you go back into the Industrial Revolution, and if you go even further into the time of twilight sleep, then you understand that when birth became a medicalized procedure and they were knocking all of these women out with scopolamine and Demerol, they were automatically placing the IV to do that. So these mothers were often drugged up. These mothers also were not able to eat and drink. So they needed to have the IV fluids to be able to keep them hydrated. But now we understand that you need to be able to eat and drink during labor, and go check out one of my other videos where I talk about eating and drinking during labor. And this kind of ties in. So the other thing though is that they were worried about postpartum hemorrhage. And they wanted to be able to deliver the medication quickly and efficiently to stop moms from bleeding out. But the fact that they were also clamping the cord right away and then doing cord traction immediately to try to dislodge the placenta, and they were basically messing with the afterbirth process and stressing mom out so she couldn't effectively release that placenta. This then led to a lot of hemorrhage. Pitocin use can also lead to hemorrhage. So if you are being induced, then naturally you're going to want the IV. And the reason for that is because you're going to have that Pitocin in there anyway. And in addition to that, you need to have the IV fluids and you need to be able to effectively add medication as needed to stop the postpartum hemorrhage. But this is not the case for a physiological birth, the true natural birth. You don't need it then. Now, I'm also going to say that if you have a history of postpartum hemorrhage and you had physiological births and you are very concerned about that, then absolutely, if you want to have the IV in place, you can do that. But there's another option of them just giving you the Pitocin in your thigh. And this is what I chose the first time. It's like, I don't know a lot about postpartum hemorrhage. I don't know how things are going to be. I'm going to accept the Pitocin in my thigh after the birth. And, she did it when I was pushing, so I didn't even notice. And then at my home birth, the same thing. I was kind of feeling a little dizzy. I wasn't sure how much blood loss was appropriate yet because I wasn't a doula at that point. And I'm like, okay, well, maybe I'll just get the Pitocin in my thigh so that I don't bleed out because I don't want to transfer after having this amazing home birth. Now I understand that you can also have some different herbs that also do the same thing and contract the uterus. And they don't taste very well, but it's not Pitocin. So it's not going to be as volatile on your body as if it was like Pitocin, because Pitocin's not very nice. It can be quite painful. And not only that, there's a chance of hyperstimulating the uterus. So you really need to understand about the risks of Pitocin and go check out one of my other videos about that. Okay, so now you understand where the medical system is really coming from is that if they are not supporting physiological birth and they have medicalized the birth process, then they're going to see a lot more hemorrhages, they're going to see a lot more complications, and they're going to be used to having the IV in place. It's just one of those things. It's on their checklist. And if the hospital has a policy around that, then that's another level where the medical system, the nurses, they're like, oh, well, we need to have this placed because it's policy. But you do not have to follow policy. This is important to know. Just because it's policy doesn't mean that you can't say no. Go check out some of my other videos on how to confidently say no. All right, so now you know the context and you understand that if you feel comfortable having the IV, you need to weigh the pros and cons for you. Don't take the pros and cons from the mom groups or what nurses would say or what doulas would say, because, we all have our own biases and our own preferences. And that is why the empowered birth method is so powerful, because it's not just about you doing what's cookie cutter. It is a completely customized process to you. So the first thing we're going to do is we aim for a true natural birth and we pull back only as much as needed. If you can help it, have the IV as your backup plan. Maybe you are concerned about GBS and you want to mitigate your risks by having those antibiotics. If that's the case, then having the IV again is appropriate. You can also have the saline or heparin lock for that. The next thing, though, is that you need to have your birth vision basically ironed out. What do you really want in your birth? And then you also need to think, okay, if this is my backup plan, where are my hard lines in the sand where I'm not going to accept the IV? And where are those lines where it's like, I need to cross this line when this indicator comes up? Again, like if you have GBS or if you happen to be somebody who hemorrhages and you are concerned about that. Or maybe it's that you really want to have the epidural. You've chosen to have the epidural. Well, again, you're going to have the IV with the epidural. This is again because you need to have certain interventions in place to mitigate the risks of the other interventions. Hensi Goer's book, The Thinking Woman's Guide to a Better Birth, has an excellent chapter on the IV. So I would suggest you check that out. Now, the other thing that I'm going to mention is that if you really want to understand making plans in a hospital setting and bringing in interventions, this other book behind me, Natural Hospital Birth by Cynthia Gabriel, also talks about the IV. So I would suggest you grab that additional resource. Now, as for the empowered birth method, what you're going to want to do is you need to have the right mindset about this. You need to get past those fears. You need to recognize that a lot of the could, might, possibly, maybe happens are in the wrong context. You're not likely to hemorrhage if you're having a physiological birth. You're not likely to need medication if you're having a physiological birth. But we have moved so far away from the physiological birth model that even in natural birth communities, they still suggest the IV or heparin lock. So you need to be able to get past those fears so that when you are doing your research, you're looking at it from the lens of, I'm not actually afraid of this happening. This is just like good to know, backup plan. But as long as you have your fears handled, nobody else can push any buttons on you. The next thing you need to do is have the right education. Do a little bit of reading. Now, evidence-based birth does have information on the IV fluid, so you can check that out. And Rachel Reed also talks about the IV and how it affects physiological birth. When you are looking at education, you want to look at how this affects a physiological birth. You don't just want to look at simple research, because research is often done in a controlled hospital setting where they have certain policies and protocols in place. And you know, birth is so unpredictable that we can't really do randomized controlled trials. It doesn't really work that way. When they attempt it, there are still people that end up dropping out of the study or opting out of the study because they just don't want to be randomly assigned to an IV or not. So do a little bit of research. And again, evidence-based birth has an article on the IV use. And, you know, the other thing that you're going to want to do is have the right environment. Don't go to a hospital that automatically insists that every single mom that comes in has an IV, because that is going to be a much more combative environment when you are attempting to say no. They may push every single button on you because that's what they're used to. They are used to moms just complying and getting the IV. So in their mind, it's safer because they don't have any other context. They haven't seen a physiological birth. If every single mom in their hospital is having an IV and you're the first one to say no, well, guess what? That is new information for them, and it's scary. Go and check out my birth advocacy report. It's inside of the Empowered Birth Toolkit, and it's inside my self-study program, Your Empowered Birth Workshop, which again, you can go and put your name and email in. So if you check out this report, it tells you about the 4 categories of fear. Category 5, care providers, they just don't like to lose face, and they will basically try to push every single button to get you to obey them because they see disobedience and non-compliance as disrespect. And category 5s are all about, if you don't obey me, if you don't respect me, I'm going to retaliate on you, because if you disrespect me, I disrespect you. And that is when you get into situations where they hold you down. And we don't want that, okay? So that leads into the right facilitators. You need to have a care provider who understands you are not having the IV just because it's policy. You are using that as your backup plan. It's not something that you're going to do, and they respect that. Now, a way to make sure that your care provider is on board is to tell them at the beginning when you're interviewing them, I plan to decline the IV. How are you going to support me in that if I'm having a hospital birth? And then they will be able to tell you what the policies are in the hospital that they have privileges at. And you can kind of gauge by their reaction if they are uncomfortable, if they are offended, if they are just going to placate you and condescend to you and tell you why you need to have it. And how can you possibly question that? You don't want a dead baby, do you? You don't want to bleed out, do you? So that's why we do the IV. If they're mostly just talking at you and explaining it to you as if you need to just do it their way without any actual conversation, that is your indication that they are not going to be the right care provider for you. And finally, you need to have that right support, because if you happen to go into a hospital, even if they don't have a strong policy around the IV, you might get that one nurse who comes in and she's looking at her checklist and she does everything by the book. And she's going to try to get you to consent to that IV. And you need to be focusing on labor, not on advocating. You want your partner to be able to stand for you and say, nope, she's not having that, and be able to stand guard. This is also why you want a doula, which falls into the category of the right facilitator, because a doula who understands that the IV is an option, not something that's actually necessary, is going to be able to stand for you much better than one that is still kind of afraid and thinks that maybe it's a good idea to have it just in case. Because, you know, there are doulas out there that are more medical minded. And I sit there and I'm like, no, you're supposed to be with the mother and showing her that she can birth without this stuff, not pushing it. And, you know, this is part of the problem, is we've got a lot of fear, and it depends on who has been trained by who and what their overall philosophy is. So go check out some of my other videos on how to hire the right doula, because there are some doulas that just aren't comfortable pushing back against the hospital. They're too afraid to do it. And you don't want that one. You want the one who, if a nurse was coming at you with an IV and about to force you to have it, that the doula would get in the way and be like, no, that's not happening. My client is not doing it. And then also document with her phone to show, it's like, I am now documenting this, that the client has said she does not consent to this, and you are forcing this without her consent. So, do you really want to go down that road? Can you tell that I'm a little bit of a spitfire, and that there's a reason I'm a virtual doula instead of a doula within the hospital? It's because I probably would be the bodyguard, the bulldog, the pit bull that wouldn't let anybody come near my client. And, you know, I'd rather not have to fight, because when I do, of course, I've got all that adrenaline running through, and it's not good for anybody in the room. I mean, I'm a Scorpio, so like, take that as you will. Okay, so now that you know about the empowered birth method, now we're going to talk about how to go deeper with this, okay? So in order to really go deep and understand physiological birth, I'm going to suggest that you need to get past your fear, first of all. And one of the trainings that I did is called the Reset Your Mindset for Empowered Birth Mini Challenge. You just go into the YouTube channel, into the playlist, and go and get that challenge, because it goes deeper into the underlying fears, the misconceptions of your family and the media, because the media often depicts the IV as well as being necessary. And then in addition to that, your education and what the medical system has basically said is safest, so that you really understand that context and you unlearn it. The next thing I'm going to suggest, if you really want to go deep, is that if you go through the self-study path, you will be able to optimize those 5 pillars I mentioned: the right mindset, the right education, the right environment, the right facilitators, and the right support. Because by doing that, by taking that self-study program, what it's going to allow you to do, first of all, is you will be able to get past your fear completely. You will also be able to understand more about physiological birth. You will understand a little bit about avoiding the induction trap, because this is another natural birth trap that you want to avoid. And it will also help you in making decisions around interventions. After that, I teach you a little bit more on how to create an effective birth plan, one that's not going to get overlooked, one that's pretty much idiot-proof, so that anybody reading your plan knows what you're about and is more likely to follow it because they're not bogged down by a really long list. And there's no contingency plans on your main birth plan. You also learn about how to hire the right care provider and a little bit on birth advocacy. And finally, we finish off with partner support. So again, you just go into the transcript or you go to empoweringmomsbirth.com/workshop, and that will allow you to go and get that self-study course. It's completely free. You just put in a name and email. And then at the same time, if you want to go for additional resources, Natural Hospital Birth is one I highly recommend. Anything by Hensi Goer. She also goes into a lot of the pros and cons of intervention. She really goes deep into the research and evidence. So that is where she's basically found her niche. And the way that she puts the information out is very easy to read. And Rachel Reed's work, Reclaiming Childbirth as a Rite of Passage, also has sections inside of the rights of protection of several chapters on the IV, so you can understand from the physiological birth model. But I can't teach everything in just one video. So the other thing with empowering moms is you have 3 paths to getting the empowered birth method. And as I said, this is path number 1, the do-it-yourself. You just go and take any of these master classes, you take notes, you get the information. You can go down the rabbit holes of research that I embed links inside of the transcripts. You can continue to binge on these videos. And all I ask is that you pay it forward. Like, share, subscribe to our channel, pass this on to other moms. When you're in the mom groups, drop these videos. And also make sure that you are commenting as appropriate, because if you comment, I will read them, I will respond, I will like your comment. I love to have commenters on the videos because that boosts the algorithm to be like, this video is getting engagement, this video is going to be shown to more moms. So I don't really want to put a lot of money into an ad budget. I don't want to splash myself all over social media outside of what I'm already doing with my team. And by basically having you pay it forward, this allows me to put the money towards things that truly matter, such as opening up more out-of-hospital options, being able to educate more of the birth professionals, getting more doulas for more moms, and essentially helping you become an empowered mom for life, whether you can work with me directly or not. The next path is self-study. If you like something a little bit more structured, if you appreciate going through courses, I do have a self-study path. Within self-study are 2 tiers. Number 1 is the complete self-study. You just put your name and email in, or you go into one of the playlists on my YouTube channel where I have these free mini trainings, and you go through each video one at a time in order. You do the work that is assigned within it. So you need to take those action steps. And at the end, you have your transformation. You can't skim these, okay? You can't skim these. You can't just take notes. You can't just pick and choose, because the way that these courses are designed is to basically deprogram you from that fear as you go through and learn information. You are also getting subtle psychological reprogramming so that you can now come to your birth from a place of power instead of fear. You get other people's voices out of your head and you're able to listen to your own intuition. So these courses are carefully designed, and they are also usually building one on top of the other. If you choose self-study, then you need to start first with your empowered birth, which is that little blue book behind me. Do the work in chapters 6 and 7. 7 is optional if you have not had more than one birth. But if this is not your first baby, then you're going to want to go through chapter 6 and chapter 7 and do all of the homework in there. Next, you're going to want to tackle your empowered birth workshop. And if you haven't already gone through the Reset Your Mindset for Empowered Birth mini challenge, you're going to want to do that step before you do the book and the course. After that, we have deeper level programs. I'm constantly building these, so there will be more self-study in the future. We also have self-study VIP. One of these is called Your Empowered Birth Academy. This is for the mom who wants to get complete control of her birth. And it's basically me coaching you without me actually coaching you. In addition to that, with the self-study VIP, you have the option of basically emailing the team and we will give you additional resources. And you also get one laser coaching call, a complimentary session where we go through your greatest challenge that you currently have, and then we help you solve that challenge. It is not a discovery call. It is an actual coaching call where you are going to get help. And then it's up to you whether you want to work with us further. But path number 3, premium coaching, we don't work with everyone who comes to us. You need to be at a specific level and you need to be able to afford it. So that is why we have the do-it-yourself path and the complete self-study, because we know that not everyone can afford the premium coaching, and it is a time commitment. When you show up, you are expected to do the work because we're showing up and we're doing the work with you, and we are putting all of our genius, all of our experience, and all of our combined resources and our networks into helping you get your empowered birth. So that path is available. You can learn more about this if you go to my website, empoweringmomsbirth.com/start guide, and that will tell you more about how to optimize any of these paths. And you can pick the one that is best for you. Because you are your own best expert here at Empowering Moms, and we want you to have your empowered birth no matter what. Whether you can invest with us in coaching, or you are better served with self-study, or you're a do-it-yourselfer, we want you to be able to have the map that's best for you, because one size does not fit all when it comes to physiological birth. If you want to have a natural birth, you need to stop falling into those natural birth traps. And I will be talking about that later in this series. Okay, so now you know about the 3 paths. You understand about the rule of 3. You know about how birth is undermined when you have this IV. So now let's quickly recap. Why don't you want the IV? Well, first of all, you don't have it if you're having a natural birth at home, right? If you were on your way to the hospital and you suddenly went deep into labor and baby was coming now, there would be no time to place the IV. So it kind of seems silly that they insist you have the IV in the hospital, but it's not necessary at home or if you are giving birth in the car. So recognize, first of all, that it's not necessary, and also recognize the context around it. So with the IV, if you have an open vein, they are more likely to be able to slip Pitocin, especially if you're in a hospital with a lot of category 5s that just don't care, that it just makes them more money. And if they slip Pitocin, it speeds up your birth, but it can also lead to more complications. Go check out some of my other videos on Pitocin use. And finally, this is just not going to work for your physiological process. You're not meant to have the IV. It could cause a lot of anxiety, which can also affect your labor and how you feel pain. And you also are more likely to have swelling, as well as your baby to have an overinflated water weight, and then their birth weight is not what it's actually meant to be, and then you're told that your baby is losing too much weight and you need to supplement with formula, and that is not necessarily the truth. So understanding that, now we are pretty much at the end. Thank you so much for watching. If you found value in this video, just please like, share, subscribe to our channel, pay it forward, pass this on to other moms. You know, there's always questions in the mom groups about the IV. And as I've gone deep into this masterclass, you are better served to just drop that link for these moms so that they can get that education, because it's the one link to rule them all right now. And eventually there's going to be more embedded inside of the transcript itself, like a little mini library. So be aware of that. And as I said, the deeper you go with empowering moms, the more treasures you uncover. And a drop in the ocean creates ripples. Many ripples create waves. Enough waves can change the tide. So if you are paying it forward, passing this on, you are furthering the empowered birth movement, because every birth can and should be a beautiful, empowering experience. So thank you again for watching. Have a happy, empowered birth journey. Whether you're birthing a baby, birthing a business or creative project, birthing a movement, or rebirthing a new version of yourself, Empowering Moms is here for you. And stay tuned because next week we're going to be talking about natural birth trap number 17, which is continuous fetal monitoring. So stay tuned for that. And I will see you next week. Namaste.